Good morning, Dr. Eric Lajinsky here, Fanwood Back Relief Center. We're back in the office. Hopefully everyone had a great weekend and a wonderful Easter. Today we're going to talk about where is my shoulder pain coming from. When a patient comes in and tells me their shoulder hurts, I always have to ask them to point to it. Because sometimes they might mean it's right here, sometimes they mean back here, sometimes they mean here at the base of the neck, or into the shoulder blade, or even into the arm. So there's a variety of different types of shoulder problems and areas of complaint that it can arise from that. So we're going to dive right into them. So the shoulder itself is a challenging area because there's three joints there. We have our glenohumeral joint, which is the ball in the socket, actually right here. We have a acromioclavicular joint where the clavicle or collarbone meets here into the shoulder. We also have our scapulothoracic joint, which is where the shoulder blade is and the thoracic spine and the rib. We have our we have our sternoclavicular joint, okay, which is right here where it meets the sternum or right in the center of your chest there where the pectoral muscles meet. So there's a lot of different areas when someone describes they're having shoulder pain. And the list of musculoskeletal problems goes on and on and on. I'm going to mention them a few here. It's actually quite lengthy. We're going to talk about avascular necrosis. This is when the bone dies due to lack of blood supply. Nerve injury, which can present in the neck or in the periphery in the shoulder as well. Frozen shoulder, shoulder dislocation, bursitis, inflammation of the sacta in the shoulder, in the bursa. Fractures in around the shoulder or arm. Neck sprains or strains. Tendinitis or rupture, labral tears, which is the cartilage rim around the socket, and then there's arthritis, all different types of arthritis, several different types, and rotator cuff injury. So you can see there's a lot of things going on. One of the most common causes of shoulder pain is impingement. This may occur when any of the other conditions listed above can happen where there's a reduction of the normal gap between the ball and the socket. We call this subacromial impingement, and this can lessen the amount of movement and cause pain on range of motion. So we get pinching in the shoulder when you try to put on your coat or raise your arm above your head to the side or straight up above. With the subacromial impingement, that's where you're going to feel. To complicate matters even more, there's also other types of problems in the body, non-musculoskeletal, that can refer pain to the shoulder. And we're going to list a few here. Gallbladder disease can cause pain to refer to the shoulder as well, to the right scapula and shoulder blade. Abdominal organ conditions, such as pancreatitis, inflammation of the pancreas. And an ovarian cyst can cause pain to refer to shoulder. An ectopic pregnancy, as well as post-surgical pain for other areas, other organ dysfunction in the body. A heart attack, when somebody feels like they're having a heart attack, shoulder pain itself can mimic a heart attack. So a lot of people are concerned when they have shoulder, especially on the left side where the heart is located, it can mimic a heart attack, but a heart attack itself obviously can cause pain into the shoulder and left arm as well. So you can see there's a lot of different types of non-musculoskeletal conditions. One more. A lung condition such as a blood clot, pulmonary embolism, infection or pneumonia, or lung cancer tumors can also refer pain to the shoulder. So it can be very challenging as a practitioner. It's my job to determine or discern whether it's a musculoskeletal problem or it's an organ problem causing referred pain into the shoulder. Either way, if it is a musculoskeletal problem, we do manual therapies, manipulation, stretching, changes in your ergonomics at work or at home, nutritional recommendations, and other physical therapy, passive modalities as well can help depending upon the condition. If it's something that's non-musculoskeletal, we'll refer you out to the right doctor to make sure we get the appropriate tests and screenings to make sure there's nothing else going on in the body. That's all we got for today for the shoulder pain. So you can see it's a little bit challenging, but we do our best to get the patient better as quickly as possible, whether it's your shoulder or your neck or your actual arm, elbow, whatever in the upper extremity. We help to discern and look at the whole body as a way of treating the patient. Any questions about this, shoot me a message. Anything else regarding anything at our practice, please shoot us a message, give us a call. We are here and happy to help. Enjoy your day. We'll talk to you next time.